Access to health care is what distinguishes us from the developing world. It's a topic that can be a life or death situation in some instances. In this country today, health insurance is a hotly debated topic. Should the government be responsible for our health care? Should they be our health insurance providers? If the goal is lower prices for everyone, then the answer is no. Now that health insurance is technically available for everyone due to the Affordable Care Act, we have seen dramatic increases in premiums for many families across this country. The Affordable Care Act has indeed accomplished the goal of insuring more people in this country, but has effectively raised the prices of health insurance for many as well. The two groups that are mainly affected by the Affordable Care Act are those in the middle class and young adults. The prices of premiums have dramatically increased for both of these groups. The Heritage Foundation reports that those between the ages of 18 and 29 have seen increased premium costs of up to 45%. And the Americans for Tax Reform have stated that middle-class families in 34 states have seen increases of 20% or more. U.S. News has reported a family of 5 that makes anywhere from $115,000 a year to $125,000 a year do not qualify for Affordable Care Act subsidies and are left alone to face the rising prices of premiums. If health insurance is an essential need, and the goal of the Affordable Care Act is to make health care more affordable, shouldn't it lower the costs for everyone? There are many supporters of the Affordable Care Act, and those who argue on its behalf are quick to defend it by pointing out some of its successes. One of the main accomplishments of the Affordable Care Act is that it allows young adults to remain on their parents' health insurance plans until they are 26. While this is true, it does not take into account those young adults whose parents do not have health insurance and want to purchase it. They have seen their premiums cost rise dramatically. Another major argument for the Affordable Care Act is people cannot be denied due to pre-existing conditions. While this was a major win for those battling to buy into the health insurance system, it is virtually one of the biggest reasons why premiums prices have increased so much, because insurers are having to cover people who are already sick. It forces them to raise prices on healthy people in order to balance the scales. Lastly, one of the major arguments in favor of the Affordable Care Act is that more poor people are insured now than ever before. This is true because the poor are provided with subsidized health care, while those in the middle class are left with no subsidies and are faced with some of the highest costs. In some instances, they have seen premiums costs rise over 46%. There are many people with different solutions that would replace the Affordable Care Act. One of the many proposals that have been introduced were those of Senator Rand Paul of Kentucky, who is also a medical doctor. He presented Congress with his health insurance plan. He proposed that Congress amend the Public Health Service Act to allow individuals to pool together to provide health benefit coverages. So organizations such as religious groups, advocacy organizations, charities could negotiate health insurance plans for its members. This would also help solve the problem of people with pre-existing conditions not being able to receive health insurance, because they'd be able to negotiate as part of a larger group. Another part of the solution that has been proposed is the idea of association health plans. These plans would allow small businesses to group together and go across state lines through their memberships in trades or professions, and they could purchase health insurance coverages for their employees and their families. This would provide more options in terms of health insurance providers and would drive down the price by giving more leverages to the business and increasing competition. Lastly, the federal government should increase the state's power of flexibility when it comes to Medicaid waivers. States request waivers from the federal government for reimbursement for Medicaid expenses. This would give increased flexibility on what is covered on the state-by-state basis and help protect those who are unable to purchase health care by whatever reason. To visualize a country without the Affordable Care Act would be a country with lower cost health insurance that still has protections for those with pre-existing conditions and allowing states to have more control over the Medicaid program to protect those who need health insurance. If health insurance costs are to go down, Congress would have to vote to repeal the Affordable Care Act. You can act by putting pressure on your representatives by contacting your senator and your local congressman, as well as voting for representatives that share these ideas. It's important to stay informed and monitor the cost of your health care. Health insurance is a service that should be purchased like any other insurance. What is important is reducing the cost of premiums and making it more affordable for everyone, so we can all live long, happy lives.